So let's talk insurance. I will do my best to try not to get on a soapbox about this because I feel really strongly about insurance covering weight care, but we'll talk about in general just what we know currently and what's available. So it can be kind of confusing for a lot of people in that your insurance company may tell you that they don't cover weight loss, they don't cover weight loss medications, they don't cover weight programs, etc. So it's important to understand there's a difference between um, like getting your insurance to cover just weight loss. And I like to think of that as just someone who may not have the medical condition of obesity. Their weight may not necessarily be causing negative side effects essentially for their life, but they maybe want to lose like 5, 10 pounds or more for an event or something like that. So your insurance company may not necessarily be willing to cover like a commercial program or like something that's offered at your gym for weight loss, but if you are being treated for obesity or a medical condition that weight can improvement in weight could actually influence, then you may have insurance coverage for that. So it goes back to the American Medical Association really declaring obesity a chronic disease back in, I believe, like 2012. So, since it's considered a chronic disease, many insurance companies are actually starting to cover for obesity care, just like if you went in for high blood pressure or heart disease, or you went in for back pain, that your insurance will cover it for a chronic or acute condition, just like any other. So, whether or not you'd have to pay for that visit completely depends on your insurance plan, whether or not you've met your deductible, what your copay is, etc. Um, so whether or not weight medications are covered very much depends on your plan. So there are certain insurance companies, for example, Medicare here regionally in Wisconsin, Quartz and Dean, have exclusions that they do not cover weight-related medications, considering them to be cosmetic or lifestyle medications. So we are actively working on trying to get that changed, but that is currently the situation in terms of prescription drug coverage. We often encourage patients to understand, though, that there are medications that can be used off label for weight that is very beneficial for weight and can be used chronically. So just because you don't have coverage for prescription medications by your insurance company doesn't mean that you don't have any treatment options available at all. So if you call your insurance company and ask them, hey, do you cover weight loss? They're probably going to say no. But do they cover obesity? Possibly. Do they, if you have high blood pressure, can you go and see your doctor and treat your weight as a way to treat your blood pressure? Absolutely. So those are the misunderstandings that really create a situation where so many patients may have coverage and support to help them treat this very complex condition, but they just have been misinformed by the insurance companies or maybe even healthcare providers that aren't aware of these subtle differences. So the other part of this too is when we look at things like coaching, behavioral support, working on our lifestyle, working on our relationship with food, stress regulation. So, a lot of that can be coaching, counseling. Sometimes we'll call it intensive behavioral therapy. So, certain insurance companies will cover that completely as a part of your preventive benefit. Many like PPO plans and straight Medicare. If someone's BMI, although we don't like BMI, but that's what the insurance companies are using. If someone's BMI is at a certain point, then and you have this benefit, your insurance company will cover 100% no copay, no deductible for you to have like 26 visits a year because it's supposed to be intensive, to help you work on a lot of the lifestyle part of management. So that's another part of this. So it really is very involved. So nutrition and dietitian support. Unfortunately, most insurance companies do not cover for you to see a dietitian unless you have a disease of chronic kidney disease or you have type 2 diabetes. So should you have the benefit of seeing a dietitian if you have obesity or questions about weight regulation? Absolutely. Is it medically necessary? Of course. Will your insurance cover it? Probably not. So you may, now it's always important to remember that all of these things are technically still accessible to you. It's just that your insurance is not going to take part in covering the cost. We are actively working on trying to get better coverage for these things. There is the Treat and Reduce Obesity Act that is out there that I would encourage you to investigate and see what you can do to rally support, which would require Medicare to cover intensive behavioral therapy as well as anti-obesity medications for those who would qualify. So I know it's probably not as clear and obvious as you want it to be, but I think this hopefully will at least highlight a little that there is coverage out there available for treatment for weight. We just have to be aware of our language and make sure we're working with people that really understand the details of this to help us get that coverage. So subscribe, keep watching, share, and let us know if you have any questions or concerns or hot topics that we can continue to provide you with all of the tools and information that you may need to be successful.